Thanks for joining us today for our webinar on data-driven decisions. Um, this is an exciting webinar for me personally because normally I do these webinars. I've done more than 10 of these, and it's usually me just talking over slides saying, this is how we do value-based care. This is the latest in AI and healthcare and all these things. So today I have Brian with me, which is really exciting. But first, I'm going to start a little bit about Ionics. So we're a tech company. We have industry experts in, go figure, capital markets, fintech, and health tech. For the folks in the US, you know that health tech is pretty financial here. So a link there. I'm a physician. I've worked in a lot of different things in the clinical field here as well. So yeah, I think the big thing here is that we don't just implement stuff. We partner with companies. We have long-term partnerships, a lot of post-trade stock stuff, and a lot of things as well. We do software for med devices, a lot of data stuff that Brian will talk about later as well, and kind of just a little bit about us to get started. So I'm Maanas. Here's a bunch of nice things that someone on the marketing team wrote about me. I have 15 years of experience, and I do consult for various companies and institutional investors. And I'm also the CMIO here at Ionics. Brian, who is joining me today, he is the founder and CEO of Calculated Health. His company, Calculated Health, yes, again, is working to shift the paradigm in value-based care and doing a lot of cool stuff with data. So we will get started. So rather than me just talk over slides and have Brian chime in, we're trying a bit more of like a kind of question answer, kind of an interview format, because the last one I did on value-based care was just me, but everyone who scheduled a call at the end, we will have a Calendly link at the end. I'd say 80% of the people called it a podcast. And I was like, I don't have a podcast, but thank you. So today we're going to try a little bit more of that. So maybe Brian, if you want to start, what was your journey into health tech? How did you get here?
Started out on the business side of things. I'm a healthcare lifer, started working in provider organizations back in early 2000s. Worked in front, middle, and back office there. That led me to Accenture, where you and I, Maanas, met and had the opportunity to work together. And was a generalist there. Started out on the provider side, then started to realize there was a lot of work that could be done on the payer side. Transitioned over there. Again, working in front, middle, back office, and process excellence and a bunch of different things, and then gravitated towards and was basically accidentally pulled into a project in like early 2011 around value-based care, HEDIS and STARS, and so helped a top 3 MA payer. Worked with a great team there and led a team to help them with their HEDIS chart chase and best practices and what they could do to improve STARS, and created a really nice model there and had a lot of success, and then couldn't escape the gravity of value-based care. So ended up going around the country to payers of all shapes and sizes, helping them with HEDIS, STARS, and what have you. And then the transition into health tech was a realization after working with all these different vendors and payers in the value-based care space, and realizing that there was an opportunity, most specifically to wield this data, to accelerate it, and to use it at the point of care, and wasn't seeing the solutions in the market that were doing that. And so, passionately believe that needed to be done. And that led me to more of the tech side of things and working on solutions and companies like Calculated Health.
And I think that leads us into our second question of what is Neuron? So
it's healthcare's first fully distributable, multidiscipline, value-based care automation engine. So what it essentially means is we've packaged, a lot of these core disciplines around value-based care and population health measurement, things like HEDIS, broader quality, risk adjustment, your STARS measures are in there, and then custom measurements. And we've put that in an engine that's distributable into almost any environment, so we can leverage the tech stacks that our clients use, bring essentially the engine to the data, And then what we do from there is help them automate that ingestion, automate that processing, and automate that distribution of value-based care insights into their care ecosystems, so that we can essentially get the most complete data set and the most complete insights to wherever the patient and the provider, the care provider or the care influencer are intersecting.
Okay, cool. Yeah, so I think we'll get a little more into just general questions. But so the topic here is data-driven decision making. So I'll just ask you, what is your definition of data-driven decision making? And then based on what you say, I'll give mine afterwards. So you go
Sure.
first.
Yeah, so I think it's about having, put kind of simply, it's we like to think about it in this way. It's the right data to the right people at the right time, so that they can make the right decision. And so, what we're constantly seeking to do through automation and acceleration of data is to take in the most relevant and most recent care source data, right? Claims and pharmacies and labs and, provider data and those sorts of things, process it as fast as possible and as prudent, and take that information and get it back to those folks at the point of care. So it's the right data to the right people at the right time, so that they can make the right decision. And so it's about completeness, and it's about saying, okay, here's the source data you have, here's what it tells us, here's the care gaps, here's the care opportunities, and getting to that care provider or care influencer at the moment that they're having that interaction in the systems that they're and innovating that into the systems that they're having those interactions with and that they use.
Yeah, I think good answer. But I think for me, it's similar. But I think that data-driven decision making is really having relevant data to either augment or alter our choices, our decisions for a positive change, right? So I think it's too simplistic to say that data will solve problems, because I've seen mountains of unstructured data in like EHR sit around and do nothing, right? They don't accomplish anything. So it's really like I've even seen when we do implement things, they fail. Like back in 2012 at Cedars-Sinai, we implemented a clinical decision support system, and everybody hated it. Like all the doctors hated it.
Mm-hmm.
So it was just kind of like, all right, here's some data, nobody wants it. Here's some data that we have been collecting that nobody's using. So yeah, I think it's really just having like, being able to collect and kind of analyze data that is relevant and that will actually make people change something, right? So I think that's like my major thing. So I have slides a little here. So I think
real quick before you dive into that, I do want to emphasize your augmentation point. So I think it is about, our best resources are the care providers who have that training, those care teams. And we're trying to make sure that they have the additional information to maximize efficiency and have everything, available to them to make the best decisions.
Cool. Yeah. And I do have kind of questions here just to leave us some breadcrumbs, because if you leave Brian and I to just chat, we're going to be talking about sports scores in 5 minutes. So so we talked a little about this, how data can do this, but what really distinguishes data-driven decision-making from like the traditional decision-making processes in healthcare?
Yeah, I mean, I think for us, the way I think about it is, I think traditionally healthcare organizations are making decisions around dollars and the operational needs of these care organizations. So processing claims and getting paid for claims, processing prior auths and those sorts of things. Those are that's where a lot of the data-driven decision making has historically been done. And I think what we're talking about is expanding that and taking that to kind of a new level and saying, hey, we understand these things about folks. There's these clinical insights that we have. We know what the care gaps are. We can, with the right sort of mechanism, the right latency of data. And so, taking that and saying, hey, it's not just about operations. It's not just about the brick and mortar nuts and bolts of moving money around and getting authorizations for things. We're trying to enrich that.
Really? I didn't.
Well, I mean, I know what it is, but I'm saying, what distinguishes, I think, what we're talking about and what we focus on, is getting the best outcome for the patient, and giving the care provider all the information they need to do that.
Yeah, I agree with that. That's what we should be going towards. So on that note, so today, how is data driven decision making actually impacting healthcare today? So like I know I hear a lot about in the future it'll do this and that, but kind of like for today, I think you have a really good kind of on the ground, boots on the ground knowledge of it. So like, how do you see it today, and what are some of the challenges and opportunities that you've personally seen?
Yeah, I think organizations, are still struggling to catch up with that. I think interoperability is still an issue. I think the technology landscape and the vendor landscape is still creating barriers. I think there's competition barriers and things, and data silos and barriers and things are thrown up, today still, and we're trying to overcome those. You see a lot of AI, Gen AI, ML sort of stuff, out there, and I think while that's very good and promising, I think there's some challenges there. Certainly, learning on the go is a challenge. We don't want this new technology to be put in a position to make decisions that alter patient outcomes, negatively and things like that. So, trying to define that is a challenge. Trying to get transparency into that is a challenge. And then I also think, those sorts of disciplines are like the shiny new apple, but I think there's still this, and a lot of people are looking at it, attention, dollars, things like that. And while there's a lot of promise there, it's still a long way off, I believe. And there's still a lot of the core foundational work that needs to be done, like what we're doing, which is essentially reducing the latency of data, automating it, to remove the manual work, and then automating it, and integrating it into the digital care ecosystem, and incenting people around that. And there's still a lot of that work to be done. And those are kind of value-based care, and then the AI stuff are kind of the two big things that I'm seeing pop up, and obviously there's the third, which is the security piece. So a lot of barriers still to be overcome, but the we need to focus on kind of those core things. And while we're building the future with AI, and some of those things, and figuring out how to get it in the system, we still need to do the nuts and bolts, and there's still a lot of
Yep.
opportunity there. So,
All right, cool. Yeah. And I mean, talked a little about security, but how do you really manage kind of integrating with these legacy systems? So I know that especially these guys who've been around a long time, they have their own way of doing things. They have these kind of monolithic systems a lot of times. So
mhm.
you coming in with your kind of engine, how have you seen like these guys overcome the challenges of integrating? Because I know it's a big challenge generally.
Yeah, and I don't know that challenge ever goes away. I think that the premise that, so we attack it in a couple of ways. I think one is, we're very nimble, and flexible with our solution. So we're bringing the data to the engine, calculated health with Neuron, and we're allowing them to take better sovereignty of their data, control of their data, security around their data. And then that starts to open things up, like automation and those sorts of things. So and why that's important to the question that you asked is if you're going to do these processes, and I've seen this over and over again with health plans and providers, is there's a lot of effort that goes in and around this data. And because of the models that exist today, they're where you're handing it off, and you're getting it handed back, and there's barriers in between and things on what can and can't be shared, and there's the need to intermingle that source data on your side, and all those sorts of things. It creates challenges, and what ends up happening is a lot of times that manual process that needs to be repeated, in ideally as fast as possible, ends up being a manual effort. And so that's a lot of the challenge. And so what we do is we say, okay, let's make that worth it. Let's do it a one-time thing. Let's get it all set up. Let's help you automate it. And now you have a consistent system that you can both automate into and then automate out of. And so it doesn't necessarily remove some of the upfront stuff. We have very talented people that help do that, mechanisms that we use to make it easier, but you still do have to kind of get all of that source data in there. But what's important is automating that, so that you do it once, you don't have to do it again, and then making it worth it so that you can automate those things to get results downstream. Whereas historically you can, and you're just kind of pushing the rock up the hill only to get to the top and have it, tumble back down every month. So we're changing that. So I think that's a lot of it. But if you can normalize and automate it, you can make it worth it.
Yeah. Okay. And so you're not renaming Neuron to Sisyphus, then I take it from that. Yes. Yeah. Okay, cool. I think if people are more interested in like how integration specifically works with Neuron, we have some, I think we have like a link we'll share with attendees only later. Maybe we'll share it a little wider because of the technical difficulties, but yeah. And I think since you've actually gone through this journey and you've, been kind of an expert, whether accidental or not, at Accenture, and you kind of came and you made, you've made your own company, made your own product in this field. Just kind of wanted to ask, what advice would you have for other folks who want to do something with data-driven solutions?
Yeah, I mean, I think have your vision and mission and stick with it. But you also have to be flexible, right? So technology advances as things move along. It's and the pace quickens. I remember when we were starting working on Neuron and those sorts of things. Data centers were, as an example, a concern, right? Like at that point there was times where you were literally, hey, who's the security guard that's going to stand outside this thing, badge access, and how many servers, and how are you going to physically secure it and digitally secure it, and all these things. And things like cloud, for example, and a lot of cloud-based solutions have come into play and change how that all works. So you have your vision, but be able to change it, and move with the times. I think also for young health tech entrepreneurs, know the job you're signing up for. So having a great health tech solution, being able to build that is awesome, but the business side of things is a whole nother job. And so make sure you know what you're signing up for, and that the competencies are going to be there to help you get your products to market, manage your business and all those sorts of things. Very important. And then I think, use your weaknesses as strengths, right? So, when we were at Accenture, Fortune 500 company, all of the trappings, all of the resources in theory, all of those things are there. But as a smaller business health tech entrepreneur starting out, and that you don't have all those resources. So take your weaknesses maybe and turn them into strengths. So, as an example, as we were starting out, right, there are some resource limitations and things that we experienced, but we were able to turn it a little bit on its head and say, okay, how do we build this solution so that it's more scalable and more distributable, and we don't have to support a whole bunch of versions and things like that, and that has really informed our strategy in a big way. Whereas that could be seen by some as a weakness, at that time, and I think certainly. Some of us thought so, but we turned that into a strength. So, use your nimbleness, use your, and be ready to connect with people, build partnerships, those sorts of things, I think are all, important for health tech innovators.
Yeah, nice. Yeah, I think the other thing too is like I lived in Silicon Valley for several years, so like general startup principles still apply. But that thing you mentioned about partnerships, and I think that's actually huge in health. Like I've seen folks get like one study or one small in at like Johns Hopkins or something, and then they just market that to hell and get like a lot out of that. So yeah, I think if you're able to kind of network your way into something and really you can blow it up. Even I found that product wasn't that good. If you talk to the actual doctors and nurses who use it, they're like, like this is just a bunch of pop-ups. But when you read any like news article about it, it's always like mentions like a big name hospital, and then it's like how great that solution is. So yeah, right. There's a lot you can do with that. We'll go into policy, which is like not my favorite thing, but yeah. So how do like the current policies impact the kind of stuff that you do, and what changes would you like to see?
I'm pro where we're headed on a policy front, at least with regards to data and healthcare. I think it does create a lot of research, study, and design opportunities and requirements for health tech innovators, at least to be aware of. But interoperability rules and things like that. There's a lot of implementation guides being put out. Obviously the fire standard, from HL7. Those sorts of things. So, I like where we're headed with that around interoperability and required data sharing and required data access. So I think I'm pro where we're headed with that. I think it just creates, particularly for health tech innovators, a lot to study, a lot to be aware of, and a lot to make sure that their solution is addressing or opportunities to address when they're going to market.
Okay, cool. Yeah, and just kind of before we move on, I know that it's almost 10:30, and but we started several minutes late due to the platform crashing. So if folks, we will have a recording that we'll send out just as a FYI, and hopefully Brian and I will trudge on into the next one. This slide I kind of added because I looked at the registrants, and we had a lot of folks from different countries around the world, and I think these are just some of the countries that I saw represented in the signups. So I did want to mention that Brian and I are both US based, so it is a bit more of like a US based conversation today, but I did want to touch on kind of the larger implications for the rest of the world. So I think one big thing that we've seen data do is kind of disease surveillance. I'm not just talking about COVID, but you could track a lot of different outbreaks like influenza in Canada. I believe there was like a malaria tracking thing in Kenya as well. So, all of these kind of things of like data to kind of help the early detection and control of these outbreaks, and even kind of public health responses can be faster. Another thing is kind of like resource optimization. So if you see like hospital administrators and even government officials in some countries, they can kind of make decisions on where to allocate those resources, where to invest in facilities, which specialties need to be staffed up in certain areas. So really being able to get that data and make decisions based on the data rather than, just like, this city has, 100,000 people, we should have X number of things. Maybe you need more childcare services in that city due to, the age demographics or something like that, right? So being able to see that kind of data is pretty cool. And then I think one other thing is kind of EHRs. So like I spent a lot of time working in EHRs in the US, which are basically billing machines with like some clinical stuff. So I think in other countries, maybe when you have universal healthcare and things like that, it's not all about getting the CPT code and getting, justifying what treatment you've given via, insurance companies. You can actually kind of streamline patient care, and you can have more kind of health information that you want to share, not like a siloed, get the other hospital to switch to Epic type thing. So there is a lot of opportunity there as well to use that data. Like I said in the beginning, for data-driven decision-making, you can actually use that data to make better decisions for the patient. And, I think a lot of times there's things that patients forget to tell the doctor. You're stressed in the moment. You don't remember that you had this other issue going on, which, also would have impacted kind of their analysis or their assessment. So yeah, having these things in front of you, being able to look at what happened previously, look at those trends, that's really important to see. Even if I'm looking at my diabetic patient, I want to see their last 3 A1C results, right? To see how it's been going. So it's like a trend of a trend. Maybe it's a little bit meta to mention, but I do want to understand their glycemic control. So I do want to see previous things, maybe see how their medication dosage changed over time, and to see like how that affected their their glycemic control and things like that. So like I'm not just waiting for like renal complications, neurological complications, visual changes or things like that. I'm proactively able to look at, hey, I think like things are getting out of control, based on these other parameters. So yeah, I wanted to also say that that's relevant for the rest of the world, and relevant for the US as well. But I don't have any specific knowledge, I guess, about a lot of these countries in Asia, Africa, Europe as well. But yeah. So let's get back to a quick thing on AI and ML. So I think it's a big marketing thing. It's like a buzzword right now, AI. So like, how has this been going? What have you seen on the ground, Brian?
Well, everybody is racing towards, at least the large tech companies are racing towards their, their partnerships or acquisitions of, LLMs and AI technology and those sorts of things. I agree with you that I think there's, and I talked about it earlier. It's kind of the shiny apple. It's everybody's focused on it. I don't know that I don't know that it needs to capture that much of the conversation. I think there's still a long way to go for health tech innovators. There's a lot out there you can do, open source things like Hugging Face and places like that. Obviously ChatGPT. There's a lot of affordable options to work on your excuse me, your AI competencies. And to be, kind of thinking through that, testing through that, and preparing yourself for that. But generally, I think it's an interesting, it's a very powerful opportunity. But I also think we need to proceed with a lot of caution, right? And I worry about in future a little bit, at least thinking on the other side of the coin, right? Like it can do all of these things. But it also, the process by which we get to, artificial intelligence being innovated, outside of like a co-pilot, like, hey, where are you going to type this sentence or these sorts of things that you're seeing roll out now, when you actually get to things like, clinical decision support and whatever, it is, very, very powerful, but it's also, there's hallucinations and things like that. And, to me, there's a premise as well that, if you haven't been able to do it, at least functionally well as human beings, right? That how is the AI going to, I know it can improve, but I worry that some of the disciplines that we haven't touched on or haven't really matured as much as we should in healthcare without AI could adversely impact AI in future and the development of that. And I just don't want my personal thing that I'm concerned about is, I guess we don't want to learn with live patients that could have adverse outcomes because of the lack of maturity in certain areas of AI.
Yeah, I think something like I recently saw like my primary care doctor for an animal checkup, and I felt like it wasn't that useful because I just got referrals, and I was like, I could have just done these referrals myself. But I was talking to one of my friends from med school, an anesthesiologist, and he said in 10 years there's not going to be primary care doctors. Like you can just have AI do this initial thing and just like send a specialist. And I was like, I don't know if that's true or not, but that was the feeling of one anesthesiologist that I spoke to. And it was kind of an interesting thought, like I think right now, even a lot of things are like, you don't know, like maybe you don't know like that, endocrinology is both for diabetes and thyroid, right? So it's like, oh, like, should I have just gone to an endocrinologist? So you go and you spend your primary care visit, you probably get some more insight if you don't have, like a medical background, but it is kind of like they will send you out for other things rather than get you the insight in the room, or they'll send you out for labs, and then based on the lab they're like, all right, now go to endocrinology. So yeah, I mean I would be interested to see how that evolves over time, if that becomes financially incentivized for hospitals or for organizations to say skip primary care, and then in the future, like how will residency change, how will medical schools work on that if that's a path that it goes down. So I thought that was kind of an interesting thought, albeit from an anesthesiologist. But yeah, so for these data in like the complex established systems, so like when they start to bring in something like Neuron or some kind of data driven technology, what are the challenges that you've seen when they actually do this in practice?
Well, I think, I guess it depends on if you're talking at, from an IT perspective, or if you're talking at the point of care. I think point of care is, getting the information or the additional information, the additional insights in front of the care provider in a way that, that will not be invasive, will not require additional systems that they need to look at, additional UIs, will not slow down that interaction, but just
no pop-ups, just
no pop-ups.
yeah.
Right, exactly. And I think when you're talking, upstream at the data sources, the health systems IT, or health plans IT, I think you're talking about some of the challenges we talked about earlier, which is, traditionally they operate one way, and when you see a new solution like Neuron, it's starting to have them think a little bit differently. So, we're working through that and helping them, automate that and make that easier, reduce that manual effort and those sorts of things. And again, there's always effort, in mapping data, bringing data in, computing data, distributing data, but you just want to make sure that it's worth it and that you can reduce the manual effort, and automate as much of that as possible.
Yeah, and I know we have like a compliance type question later as well, but just because we talked about this, I think especially to talk about alerts or pop-ups, I think one of like the frustrating things that I've seen is when you're prescribing medication, you get a pop-up for drug interactions, and it sounds like it's a big safety thing, and you keep them because of safety, but I'd say like unless it's changed, and maybe AI will change this, I'd say like 90% at least are like useless. Like they're not real concerns that you would think. Like if it's like a black box warning or something, but like you get weird ones. You get like Vaseline conflicts with Doxy, and you're like, what? Like this isn't a real thing, is it? And like you're just clicking away all these things. So when you actually get a real pop-up that means something, you're in the habit of just clicking it away. So yeah, I think on these complex established systems, a lot of things are done in like the guise or the umbrella of safety, and it really ruins kind of like how the user feels, if it's a clinician especially. It's like you have to go and start doing a lot of like IT entry. So yeah, I think when you're adding an additional layer on top, it's great to already know that the system below is like already cumbersome and bulky. So it's good that you're already thinking to be like as invisible as possible, like, but while still giving kind of that information at the point of care or wherever they need it, right? So.
Right. I also think really quickly on that,
Yep.
expounding on, we've got to use care influencers more, right? And that can be customer service, that can be patient access and scheduling, that can be other settings outside of just primary care. And so, not only do we need to give the care provider at that moment the information and put it in a way that's elegant, that they can have an opportunity to use it, but not necessarily be forced to navigate through it, and use it as an augmentation. We need to augment in general that specific point of care with all of the opportunities that we have, to support the physician. So messaging around, testing and care gaps, and trying to, incent and inform people to go take certain actions, that can be more broadly distributed. That responsibility can be more broadly distributed in support of, of the provider or the PCP or whatever, right at the point of care. That can be going on year round. And that helps reduce that burden and that pressure on them to do, a whole lot with the data.
Okay. Cool. And I think we're close to wrapping up, but I do want to see, kind of like the deals and sales cycle of this. So I think a lot of us, maybe I'm speaking for too many people, but I think we don't really know what's happening on the front lines. Like we just read about how things are going, like the adoption of things, and a press release from Kaiser that they've invested, blah, blah, blah. But, I guess like how are companies kind of calculating their investment in data? Like I'm sure they have some kind of ROI thing, and they, when you're talking to them, when you're pitching to them, it is something that like they are, kind of speaking to you about. So without naming names, can you tell us something about how that's going?
Yeah, I mean, I think you hit on it. It's it's ROI. It's got to be as strong as possible, right? And sometimes you're dealing, at least in its most broadest application, you're dealing with, with the theory and the art of. So you have to be as close to the numbers as you can. You have to have good ROI there. You have to get in people's budgets, and get in those conversations. And then you have to be flexible, and you have to be very cost efficient, I think, to make your way in healthcare today. Or you have to, pin yourself to a set of very large organizations that have major dollars, and be connected to something like a Gen AI where people are throwing money at it really before they fully understand it, because they don't want to get left behind. So you have to pick kind of one of those paths. So we're very much a focus on the ROI, come in at a very cost efficient price point, help our clients and potential clients understand what that ROI is, and make sure that it's it's at least double digit X, right? When you're talking to folks. And so and I know that you've been reading this too, Maanas, some of the contraction in and probably spend in dollars, and you're seeing some of the forecasts and some of the layoffs and some of those sorts of things that are starting to bubble up in U.S. healthcare. And so, very important to be talking ROI, very important to be a cost-efficient solution. And like we try and do, with Neuron is really help them, not just in what we do to do Neuron, but also like that there's broader cost efficiencies and people efficiencies, not necessarily in removal of jobs or anything, but like it frees people up. And so I think what's important is, you got to really look at that and look at your client's situation and help articulate that, that value.
Yeah. And, just on that point, kind of like the freeing people up, I think that's some of the solutions that we've done at Ionics, even though may not be in health tech, in fintech kind of, it is like the automation of these internal processes. So like, for example, like everybody's making it really easy for, I'll just use like Spotify as an example, since we all use Spotify probably, but Spotify for users, it's really easy to add a song to a playlist, right? So that's like a super simple thing. But whereas for someone to add and remove songs on Spotify's end, it's probably like they're in like a database. There's no like drag and drop for them, right? Like it takes them a long time to like add songs, remove songs, change things. And of course, like, like these aren't happening on like the production server. They'll be doing it in like their dev, and then it'll get put to QA and then put, probably to prod. And so, kind of having those tools for your internal staff has been like game changing for a lot of our partners. So like we've done stuff obviously for users, but eventually, our partnership, we help with like those internal automation tools. And that's been actually huge, because like, for example, even if you look at like a medication database, if you're not getting it from FDB, if you're doing kind of one of the other ones, maybe you're at Wolters Kluwer, but you're pushing certain things to your physicians. And, as a doctor, it's really easy to type in, like Augmentin, and it pops up with the things. But if there's a new form, or, like we would have stuff like injections come in like a 2-pack now. So that new 2-pack comes and it needs to be presented, to the physician in a different way. Actually, at the EHR company, because I was a clinical product manager previously, it was a lot of work. Like we had to create a ticket and it goes to a different department and they do stuff. And whereas it just seems seamless on the front end. So imagine having like these tools where it's very easy for me to just be like, all right, this thing switched out with this. There's a 2-pack and it's updated. So yeah, I think like, when you talk about investing, when you talk about the ROI, giving people back those hours, or being able to kind of explain, hey, like this is going to really free up your guys to do more stuff, better stuff, rather than like, you talked about the human capital, right? Like there's a lot of layoffs going on right now. So, it is kind of like, let them be more efficient with their time instead of, running scripts and making tickets for the data team. You just have them do it themselves. So yeah, I think that's like another thing I just wanted to mention. And I think this is our last real question slide. So compliance and regulation. I did see we had some compliance folks who joined us today. So how do you ensure compliance with international health data regulations? GDPR in Europe, HIPAA in the US. There's other stuff in California as well. So kind of what steps do you take when you're adapting to these new regulatory changes?
Well, you have to understand it. Obviously, you got to read it. You got to get your compliance people looking at it. You got to get the policies updated if necessary, to be able to address that and get the policies and procedures in place and enforce those, because you don't want to have any missteps. And I think, more broadly from a calculated health perspective, and with our product Neuron, we're trying to change the way we address that in general. by not taking any PHI, not taking data off site. We don't monetize any data. We just provide the clinical insights to clients, in the environment of their choosing. And so we both comply with those, but also, and you have to stay up with those clearly, because a misstep could crush you as a business. But we're also trying to shift the way that's done. So instead of taking data off site and those sorts of things, we don't seek to make additional products off of that sort of stuff. The data that we would get from an insurer or a provider, we don't seek to monetize that, and that's where a lot of those things come in. It's data sharing, data privacy, and use of data for appropriate purposes. And so we really try and limit all that as a business model, not necessarily for regulatory compliance reasons. We just think it's the right thing to do, but that's part of how we attack that as well.
Yeah, let me restate just to make sure I understood what you said. So you with HIPAA and things like that, I'm not super well informed about GDPR, honestly, but with HIPAA and things like that, you're basically saying that because Neuron runs locally in whatever client environment, so it's basically you are integrating an instance of Neuron for them, and all they reach out to you is basically that, like, hey, have I paid or whatever, like the license for the month or whatever, and then they run it all locally, so they don't really give you any data. So some of these things don't even apply.
Right. Well, I wouldn't say it doesn't apply, right? And it doesn't keep you from having to have and enforce all the policies around.
Right. Yeah, I'm just saying.
Generally, it makes it a little easier on us from that perspective. But yeah, we do not take PHI off site. The only thing essentially you need from us is an access token to be able to run the engine, which is secure authorization. So yeah, it makes it a little bit easier on us, but still, all the policies have to be there and everything has to be followed. And,
right. Yeah, no, understood. I just felt like it was an interesting caveat to share that. Normally you think about, like, when you're doing data analytics, you're sending it someplace, at least through the internet or something, right? So if you have it on your own server, like, that's all happening internally, even though the data processing, the engine's kind of installed there. So I don't think I've seen, or I don't think I've heard of another product that works like that. But I'm not super well versed in it, but it seems like a new. Is this like an innovation on your side, or is this something that you got?
We believe so. We're taking the engine. The simple way we like to say it is we're taking the engine to the data, not the data to the engine. We're giving the client control over that. We're giving
that's good. That should be a tagline or something. You need to market that. I think that's. It feels like really powerful. But anyways, let's move on. But yeah, really cool, Brian. I think that's cool. So I think how we can help, I'd say, the number one thing is kind of expertise. So I always have this saying: you diagnose before you prescribe. Yeah. So it's really like, what problem do you really have? I've seen it stated a few different ways. This is my trademarked way, or maybe I stole it from somewhere, I don't know. But it's really like a lot of companies have a lot of wants that they really have, and they have some needs as well. So, like, what are the needs that you really want to address? Especially if we're talking about data today, it's kind of there's things you want to do, but to Brian's point on ROI, it's like, where can I get the most bang for my buck, or what's the lowest hanging fruit I can do? Especially these larger companies have short term, like what can I do for Q3 to improve? And it's okay, let me understand what your business does, as far as how this will move the needle. And so I think there's a lot of expertise we can share, but it has to be kind of more specific. And I think for implementation, we do go with an ongoing partnership. We don't just implement or just create software. And we have done a lot of custom technology builds, where we, will work with the client and say, for example, we did one in Canada as well, where it was medical device software. and it was moving from one standard to another. So they already had something that worked, but it was like, okay, like when I had my first call with them, I was like, why are you changing from something that works to a new thing? And they're like, oh, well, right now it runs like it needs to be connected. It's on like a USB type of thing. So in order to get the data, we want it to move to a new standard. So they were looking at like Bluetooth, or they were looking at some sort of wireless thing, because it was like a motion related thing. So then it turned into a conversation about, like, how do you want the data to go and things like that. So yeah, I think for these custom technology builds, again, the expertise comes in. So yeah, there's a bunch of things we can do here. We do have an offer here. I think we'll share. I think when I end this webinar, it's going to go to a Calendly link. So if you want to schedule time with me, I think we're only doing it for folks who attended. And there's also a Calendly link for Brian, which I think we're going to email out to all the attendees. So if you want to chat with Brian, and maybe even take a look at Neuron, maybe not immediately, but there are opportunities for folks who attended today to say thank you. So stay tuned for that. And I think we're already long, but here's our info. I think Brian's LinkedIn is not updated here, but you can just search for Brian on LinkedIn. Adam, feel free to add me as well. My Twitter is my own personal Twitter. So if I have tweets about random AI stuff or beer, please feel free to ignore those. But thanks for joining, everyone. I think hopefully we were able to answer some stuff and give you some informative insight. And thanks for joining, Brian, as well.
No problem. Happy to be here. Feel free, anybody, to reach out. Happy to help you with wherever you are in your journey. And I think we just like to knowledge share on this sort of stuff. So if you have questions or specific scenarios, just give us a holler.
Cool. All right. Thanks, everyone. I'll send you to my Calendly now. You can schedule time if you like. Thanks.